Now it comes. So today we are going to address the basic models that I believe must necessarily be taken into account when we are in contact, when any activities are implemented to prevent gender-based violence, in particular domestic violence and sexual violence. These are going to be the key models. And today we will start with basic theoretical models that help us better understand specific features of the issue, of the problem that we deal with. I am Marta Chumalo. As you can see, I work at an NGO center, Women's Perspectives Center. For 25 years now, we have been operating in the city of Lviv. And our main focus is women's rights, facilitating access to services for women. We have shelters. Before the full-fledged aggression of the Russian Federation against Ukraine, we had one shelter. Previously, we had two, but then one was closed down, and now we operate 7. We work a lot with internally displaced people. Mostly these are women. However, we also have shelters for women survivors of violence. And thus, we have a lot of experience of direct provision of services. We work both at shelters, we provide psychotherapeutic support, we provide legal protection and support of lawyers. I provide psychotherapeutic support. Mostly I use EMDR method and CBT, cognitive behavioral therapy. I also work a lot with groups of people who respond to the issue of violence. And you see more information about me on the slide. And now I believe we can proceed with theoretical material. I'm ready. Let me just say that we are going to have 3 webinars. We are going to record them, and we do hope that we will now start recording in all the languages. We will definitely have recordings in English, Ukrainian, and Russian, so you will be in the position to go back to the recording. After all the 3 webinars are over, there will be an easy test, and after that, if you pass that, you will receive named certificates. After the 3rd webinar, to all the participants, to all of your emails, we will send the invitation for the test. And if you complete the test, you will receive your online certificates. So I believe, Marta, that you can start. Don't hurry, though, but let's start with the theoretical part while we address technical issues. Okay, then let me start. And the first thing that we start our theoretical discussions with when we address models and the instruments that we use when we respond to violence. This is the model by Jerzy Malibrude. This is a Polish human rights activist and psychotherapist who has worked a lot and who is working with addictions. And he has this model that explains how violence is different from conflict. And if you have access to your chat box, I would ask you to write answers to this question. Why do you think we need to distinguish violence and conflict? Why is it important to know if it is violence or conflict? Because sometimes Well, let me first address the question about the dates of the webinars. We have the webinars today. This is the ongoing event from 11 till 1 p.m. Kyiv time, and then on Wednesday and on Friday, every other day. Same time. So Marina writes that we need to distinguish conflict from violence in order to know when we need to interfere, to intervene. And that's right. Why we need to understand that that's a case of violence. If it is violence, the state has the duty to intervene, while if it is a conflict, we do not intervene there. This is between the two parties, and that doesn't require any external intervention, because a conflict, that's a normal communication process, while violence, this is something that entails criminal liability. And we are now speaking in the context of different countries' jurisdictions, so not always there is criminal liability for violence. At the national level, many countries don't yet even have laws on violence, and in Ukraine, not every kind of violence entails criminal liability too. So the general frame is that violence, it is something that requires intervention, interference. Thank you for answering that question. And now we will proceed with Jerzy Malibruda's model. So he focused on the following. He says that there need to be 4 conditions so that we keep 4 key features that identify violence. All of them need to come together in the same case. If one element is lacking, most likely this is not violence. This is something different, maybe conflict, maybe some other kind of interaction. And the first feature is intentionality. This is about actions where one individual does something to another person intentionally, on purpose, in order to do some damage. For example, I now have a client who says that, well, she divorced her husband and they separated their property, their assets, and one room belongs to the husband, while the wife uses the rest of the rooms in the apartment. And he comes at night, and she cannot lock her door, and she says, I wake up because he stands near my bed. And she told him, don't enter my room. It doesn't feel nice. I don't want you to be there. He doesn't care. So at night, she may wake up and see him standing next to her bed. Sometimes he makes pictures of her or just standing there looking at her. And this is done intentionally. This is a clear feature of intentionality. He knows she doesn't like that, and he still does that. And here, there is also the second feature, and this is causing harm. This is something that we always take into account. Actually, based on harm, infliction of harm, that we often identify cases of violence. So following this case, again, this woman developed sleeping problems. She often wakes up. She does not have this deep sleeping phase. She's very anxious. So we see very clearly that harm is being done. So physically, nobody actually offends this person or attacks this person. Physically, he does not attack her. However, he does damage, he does harm.
And there are different contexts, as there are 4 types of violence according to the Ukrainian law and the Istanbul Convention and some other laws working in other countries. This is psychological, physical, economic, and sexual violence. Likewise, we look at what harm is done in a particular case. So this can be, and quite often it is the most obvious harm, is physical harm, bodily harm, injuries, and we can get experts' conclusion on bodily harm. That's quite often bruising, something notable, something visible, and that is registered as harm. Also, it is quite often to document or register economic harm. For example, when a person breaks her mobile phone or breaks a door, so there is economic damage. For example, kids' textbooks are torn. So this economic damage is also quite obvious, and it can be documented so that later, if we seek legal recourse, we can easily prove the economic damage. However, in our context, it is quite difficult to work with psychological harm, but we get more practice now, and the situation has been changing. The psychological harm is registered by conclusions of a psychologist, for example, and we see that this practice has been broadening in our context. We, as psychologists, provide our conclusions on what we see and how the person is affected emotionally or psychologically, what complaints she has, and what it is caused by. Also, psychological harm is documented through medical certificates. If a person seeks medical aid and gets a certificate that she had problems with some somatic health disorders, we can also use it as part of the evidence if we speak also about health problems, like basically what I said, physical harm, and it will be considered in the court as the proof of the harm. I wanted also to say here that if we speak about psychological harm, then the same actions may be considered harm or not, because, well, it may cause damage or may not cause damage. It all depends on the context, on the personal factors of the affected person, and we need to be very careful about that and consider each case individually. Just recently, I was visited by a man at our office who said that I'm a victim of domestic violence, and my wife keeps nagging me, you know, keeps criticizing and swearing at me because I come home late and I don't bring any money, and so there are arguments all the time. So what do we do in this situation? We follow the model of Jerzy Malibruda, and I have this nice question which I always teach police officers and other responders to violence. I teach them to ask this question. So this question is, so what? So what? Okay, you come home late and she starts nagging you, as you say. So what's next? What's happening after that? We need to know what's the consequence for you. And he said, so what? Yeah, nothing. I go to my bedroom, turn on my PC, she goes to her bedroom, and that's it. So there is no harm caused here. Here we see nothing visible, so like lack of harm, absence of harm. I see some participants raising their hands. I suggest that we follow the main models, we discuss them, and then we will have an opportunity. I will leave a certain period of time for the Q&A session so that I could answer all your questions. Marta, if I may suggest, the participants can write their questions in the Q&A function. It will be more convenient if you all park your questions in writing, not in the chat, but exactly in the Q&A part. And there we will be able to ask the questions and Marta will be able to answer. We cannot give the floor to everyone who wants to ask a question, unfortunately. So there is no point in raising a hand. We cannot give the floor to all of you. Please write your questions into the Q&A section. Thank you very much, Victoria. So the situation with harm or damage is maybe not very obvious sometimes, and we need to discuss it in more detail, I think. We need to investigate into a particular case when it happens. So the same action, as I've already said, can be considered as something causing harm or not. So, for example, even the same words. For example, a man speaks to his wife using some rude words, calling her names, and she answers with some swearing, rude words. It may happen. That's a communication, so to say. And if it does not cause harm, if that's the way they communicate, that's their style of communication, that's how they converse, then we see that there is no harm done. But if the same words he uses to her and she gets her trauma relieved because of that, some trigger works, and she gets a mental breakdown, starts thinking about her future, her anxiety grows, she gets some panic attacks. So if this interaction causes some consequences to her condition, to her feeling, then we can assume that we have here violence, not a conflict. The third condition that need to be met, according to Jerzy Malibruda, is the violation of human rights and freedoms. So in violence, we always speak about violation of human rights. So what are those rights? Well, there are many of them. They are basic rights. This may include, well, first of all, of course, if you have comments on what human rights are violated, write them down in the chat and I will speak about that. Well, first of all, that's quite often the right for free movement. There is sometimes a situation when an affected person is well limited in her movements. So like, you will not get out of this house. So recently there was a case when a businessman, he went to his work, he locked his wife and the kid in the apartment and opened the door only when he came back, and then they went out for a walk together. So that's quite a strict restriction of the freedom of movement. Another case was when the husband he completely blocked all the windows so that the wife could not get out of the house. They were living on the ground floor. So when he attacked her, she could not get out. Another situation was, for example, when the perpetrator, husband, kicked his wife together with the kid out of the house. The child went to the school, and the wife had to spend the day outside and come back only when some of them came home, either this child, a fourth grader, or the husband. And that's another violation of human rights. It may be a different right, the right for bodily integrity, and it's quite often violated. And speech freedom, yes. And when I mention these rights, I well, recall a lot of cases we've worked with. So these rights are quite often violated, and we need to understand that violation is not always violence is not always a violation of human rights. Quite often, a lot of rights are violated. So, for example, the right to religion, like you go to this church, or you must not go to this church. Oh, or the man may destroy all her religious books or journals. So that's the kind of intervention we're speaking about, or economic violence, when there is a restriction of the right to work, when a husband forbids the wife to go to work, saying something like, my wife will never work, and that's it. And whatever she wants, or whatever she likes. We've had this case when he was a doctor and she went to the employment center to, well, at least to be able to get some savings and spend some money, because he doesn't give her any money. And from that employment center, she was sent to various interviews to get a job. She's also a health professional, and he goes together with her to those interviews, persuading his colleagues not to give her a job, to reject her, telling them that she doesn't fit their need. And that's a violation of human rights. It's the intervention and prevention from realizing her rights. And the fourth, a very important condition for understanding violence is, well, because if we understand this condition, it is very easy to understand the essence of conflict. That's a significant superiority of forces of the perpetrator. That is, perpetrator always dominates. And having like superior dominance, yes, significant, quite often, though not always, it's physical strength. And that's why we say that most of violence is caused by men, because very often they are physically stronger. So this physical domination gives more opportunities for violence. Conflict, yes, there may be conflict, but it's not always physical strength. It's maybe economic domination, like I earn the money and I will tell you how to behave, or where to work, or what to do, or what to say, or how to look, and so on. Only because I am the major breadwinner in this family. Here on this picture, you see the conflict, yeah, where we have two approximately similar parties, similar in strength or in power. And this picture, well, it involves communication, sometimes very emotional communication. When, for example, we come up with arguments, we may shout at each other, we interact emotionally. So that's how it's represented. And it's not always a pleasant interaction, of course, but we are standing our ground. We can interact bilaterally. And violence is always a unilateral interaction. So one party dictates to the other, takes some actions against the other. So we have this very big difference in power, and there is the opportunity to realize that. So quite often we see the situation when there is superiority in power, but it is not used. The problem arises when this difference in power is being abused. The best illustration of that is relations between parents and children. We always have this superiority in power. We are physically stronger, we are economically dominant, and psychologically too. But some parents abuse this power and start um, violence using this difference in power, and other parents don't abuse it. So there may be well, superiority based relations which do not involve violence, but this situation is, well, quite prone to cause violence. We have studies. So, well, we always ask the colleagues when we take new cases, when a new client comes to us, for example, complaining about domestic violence, we always ask about the conditions of the first physical violence. When did he hit you first? And for the first time. And we almost always see that there was some leap, when the power difference drastically increased. Like, for example, the woman got ill and violence started. She became pregnant, violence started. So she gave a birth to a child, the violence started. This may also be a situation when she was fired from her job. So there is economic dominance now. So we had approximately similar relations of power, but at some point, these dynamics were violated, and this change of balance is a precondition for violence. It's not a sufficient precondition, but it is necessary precondition. So to do violence, I need to have this difference in power. I need to have superiority. And why is it important to understand this? Because these dynamics show that there may not be two perpetrators in one case. There is always one initial perpetrator. We can come to a situation and see actually harm caused to both parties. But to understand the situation, we need to understand that the perpetrator is one. And the situation is when it's violence, is when one party is dominating. For example, just recently a police officer told me a story.
They came after a call, and the situation developed as follows. A man was suffocating, strangling a woman and she had visible bruises on her neck. While she, when she was fighting him back, she scratched his cheek. And so the police officers came there and they saw the man bleeding, and that's harm, that's damage. According to Jerzy Malibrude, the first three features seem to be in place. But in order to understand what's going on, it is important to understand which of the parties has dominance, has dominant powers. She was fighting back, she was defending herself, and she scratched him. That doesn't make her perpetrator. So we need to know, to understand who the primary, the initial perpetrator is, and then through that lens, we need to explore, to analyze what happened then. That's a model that I believe is so important to understand at the first phase of communicating with the survivor. In cases of domestic violence or gender-based violence, we need to see, to pay attention at who the perpetrator is, who the survivor is, and who dominates, whose powers dominate. I don't know if you have any questions. If you have any, you can write in the chat box. Otherwise, we can proceed with the next important model that is quite well known. And Marta, I believe that we should not be distracted by questions. You just go on, and as soon as questions arise, I will address them to you. Okay, Natalia is writing about risk assessment. Well, yes, risk assessment is done by police officers, but this is actually based on those theories that I'm speaking about. A risk assessment is made, is done in order to to use the bearing order and so on and so forth. So we have analyzed Malibrude's theory, and now let's address another basic model by Eleanor Walker. She was a survivor of domestic violence herself in the US, and she is well known for her model of the wheel of violence. Here it doesn't look like a wheel, rather like an egg. However, the idea is that any violent relationships that happen, they happen according to a certain regularity, a certain cyclical procedure. If this wheel turned once, there is very high probability that the wheel will keep going, whirling. So what Eleanor Walker says, there are different models based on her theory, but the main idea is that the process is cyclical, as a cycle. So some speak about 3 phases, some speak about 5 or 7. Different sources suggest different ways. However, I mostly focus on this 4-step model by Eleanor Walker. This is where we observe that first tension goes up, then explosion happens. When at the first step, when the tension goes up, Well, it doesn't mean that it is the first one. It may start at any point, but this is the phase where resentment grows. I become resentful. I become irritated. No matter what you do, if you come or you don't come, you sit down or not. If you offer coffee or tea to me, if the coffee is hot or cold, it doesn't matter. Anything makes one resentful and angry. And there, women often try and fit into those expectations. We may hear from them like, kids, dad is going to come tired, let's clean the apartment or do homework. And then dad comes, everything is perfect, but dad anyway tries to find faults in order to explode. Because this internal growing level of tension, it is like the spring that is becomes ever more tense, and then it explodes. And that often results in doing harm. There is a lot of pain and suffering that may result from that. Often these explosions also include physical attacks and physical damage. And after that explosion, the parties go apart. So we have this phase where we go to different rooms, where we start feeling pity for ourselves, where the survivor thinks, why do I need that? And Marta, just a second. We have this slide in 3 languages, so maybe from time to time you can change the pictures so that all the people could, all the participants could read the text. Okay. Let's stay a bit on the Russian version, and then we will proceed with English. So, at the phase of distancing, the perpetrator starts accusing the survivor and says that she exaggerates, that she was to blame, of that he committed an act of violence. And quite often the contact is interrupted. They are distanced, they are far from each other, and they do not interact with each other. And after a while, honeymoon starts. So the next phase, this is the phase of honeymoon, when they come to peace together. And there, the perpetrator often says that he is sorry, or they start communicating to each other, and the perpetrator may say, well, I don't know what happened to me, sorry, let's start from a new page, a blank page. I will try to avoid that in the future. So quite often the perpetrator starts apologizing and suggesting peace. And there, the key aspect in Eleanor Walker's Wheel of Violence, there is this key moment that helps us understand the phenomenon of violence. Without this honeymoon phase, GBV or domestic violence would be resolved very easily, just as any administrative offense or an act of hooliganism or whatever. We would never have these problems when we try to deal with these cases. Without that honeymoon problem, we would honeymoon period, we would have no problem, because when a honeymoon happens, the victim often withdraws the application, the complaint. She often stops attending her therapy or dealing with the counselors. She says, that's okay, I don't need any help from you. Sorry for bothering you. It's not going to happen again. And this issue of honeymoon, this is the worst thing, because it really undermines interaction with those people who help the survivor, because the survivor distances herself or himself from those helpers or counselors or any experts who try to help her, and starts going closer to the perpetrator. And why this honeymoon exists? Unfortunately, we do not have time for a very detailed communication in the chat box, but I will try to ask questions and answer my own questions. So the honeymoon, it is the most damaging factor if we speak about organizing access of victims, of survivors to services. The honeymoon actually exists because in our brain and based on our experience, we have this experience of positive interaction with the perpetrator. This is not a stranger. This is a person I loved or maybe who I still love. This is the person with whom I was vulnerable, who helped me to resolve some difficulties. We would overcome some problems. We were happy together. We delivered children. We underwent some trials together. So this is a dear person. So my brain knows that I felt good with this person. And thus, when I go through this experience where this individual with whom I had this history, positive history, when they come and say, look, sorry, I will never do that again, I promise, let's start from scratch, there my brain just resonates with that, with those memories where I know that he can be good, because I did not marry someone who is violent. I married someone with whom I felt good, who I love or loved. And now this person comes to me and says, let's start from scratch. And then we turn the page and we start from scratch. And we may forget. So survivors often say that, yes, I will give him another chance. I feel pity for him. I see that he wants to change, and I give him this chance. This phase of coming back to peace, it is key for understanding domestic violence. And you see, without this honeymoon phase, all issues of domestic violence would be addressed very easily. So after a while, this wheel starts making another, starting another cycle with growing tension. Again, coffee, not tea, hot or cold, soup, or why have you come? Why have you left? So this wheel starts turning again. And there, to understand this model, it is important to take into account several aspects. First, why does it turn? Why does the wheel turn, keep turning? Because we could come to peace and that would be fine. So it would never start turning again. But the wheel is turning because my brain understands and gains this experience. The experience of that violence is a very efficient model of behavior. This is what makes it possible for me to achieve what I want. I do not need to come up with arguments to ask someone or motivate someone. No, I just attack and everything happens as I wish it to happen. And then my ego is inflated. Everybody starts seeing me, understanding who I am under the circumstances. Everybody respects me. I become the center of everything. And then my brain gets a lot of hormones, a lot of pleasure, neuromédiators that give me pleasure. And this is something that should happen, I think. And next time, so if I hit my child for the first time, the probability of the second time increases because I already have this neuron connection that it works well, that violence works. It is efficient for me to achieve my objectives. And thus, next time, my brain will much faster jump on this violent model. And this is the link of intensity and time period. You see, the first explosion, this is the peak, first explosion, first case of violence. It could be not very intensive, like pulling or pushing someone or squeezing one's arm. But further on, as you can see, the intensity goes up and up, and violence happens incrementally. And here you can see the dynamics. And between these explosions, the period of time becomes shorter. You see shorter and shorter. So between these peaks, there may be also smaller, low intensity peaks. But the general dynamics are this, that first you have low intensity episodes, but after a while, this goes really high, and that may result in physical damage, serious damage, severe traumas. And another aspect that we need to keep in mind, it is that between the first and the second episodes, second and third peaks, time period shrinks. While between the first and the second one, maybe 2 years pass. I have a client who said for 2 years, I lived okay. There was no violence. After that one single occasion, he said he was sorry, and for 2 years we had no problems. But then it happens more frequently. Because you already have this neuron network in your brain, and the brain starts just going along the track. On Wednesday, we are going to speak more about the perpetrator, about their models of interaction and their perspective. But today it is important to understand that the time period between the explosions, between the peaks, goes down. And above all, this happens at the expense of the honeymoon period. Honeymoon period shrinks. It becomes shorter and shorter. And in long-term, extremely violent relationships, honeymoon may disappear. There are a lot of couples who live in the system of growing tension, explosion, distancing. Growing tension, explosion, distancing. So only 3 phases, according to Eleanor Walker, are left. No more honeymoon. No one says they are sorry or brings presents, and so on and so forth. So this is the model that needs to be taken into account. And when I work with survivors, quite often at the first session, I try to draw this wheel of violence for them, to make this picture for them, in order that they could recognize themselves in this interaction. And then I asked them, why do you believe the tension may go up? Well, she says, I can recognize that. He looks at me in a different way. He breathes in a different way when we are in the growing tension phase, as if he starts to look for faults. So there are the specific behavioral signs in every kind of relationships. For explosions, that may also happen differently, distancing as well. So with this illustration, we kind of ground the situation. We counterpose it to this particular relationship. And I always ask them, where are you? At which phase? And the woman may say, growing tension or distancing, or, well, she may name any phase. And then I say, what's going to happen next? Tell me how it happened last time. How did it happen after this phase? What happened? And what's going to happen next? And then the survivor starts seeing her frame. What's going to happen next? If she, because she has been going in circles for years, and it's not for nothing that she comes to a counselor. It doesn't happen often that survivor, a victim comes after the first episode of physical violence.
So there were cases in Britain, for example, when they spoke about a large number, I think more than 20 cases of domestic violence that took place before the survivor starts looking for aid. So she finds herself well in this, recognizes herself in this situation, and quite often, as it allows normalizing her condition, normalizing the fact that she sought aid, because she just understands that she was unlucky. It's not because she did something wrong. The violence is not caused by her fault. It's a model that works whenever violence happens, and she was just unlucky to get into this wheel. And at the first stages, we just provide them with understanding of the situation they are in. This Eleanor Walker's violence wheel is a good model for that. And we also need to take into account this model. It's also quite important, in my opinion. That's the syndrome of acquired helplessness, learned helplessness syndrome. Two researchers in 1964, when there was still no for forbidding of the experiments with animals, they did some studies with German Shepherd dogs. They put them into the cages and hit them with the electric current. The dogs suffered. They tried to destroy the cages. They tried to get outside of the cage, because that was a very traumatic situation for them. But they could nothing worked, and sooner or later, all the dogs just froze in some part of this cage, some in one corner, others in another corner. So, and the time when they froze, when they stopped, depended on their personality, but sooner or later they all stopped and just froze. And when they all froze, they stopped fighting. They stopped fighting. Yes, they minimized their contact with the traumatic factor and just tried to survive silently, still suffering. And when they are like just tolerating it, In some cages, half of the cage lost the electric current. There was no shock in part of the cage. In some, they opened the doors. In some, they removed one wall. In some cages, they removed all the walls of the cage. And we noted outside what's going on with the dog. None of the dogs moved. We saw that the animals kept lying helplessly and suffering. Even though the doors were open, there were no walls to the cage anymore. They could just move from one place to another and stop suffering, yet none of them moved. So when the researchers Seligman and Meyer took the dogs with this learned helplessness, that's what they called the syndrome. When we remove those dogs with learned helplessness and let other dogs in, they start suffering and fighting again in those cages, and they don't freeze yet. Then if you open the door and give them an opportunity to quit, they quite often find this exit from the traumatic situation. So they get free. But when the dog has already learned to be helpless, it stops fighting. And Eleanor Walker well, why is this syndrome is important for GBV cases? Eleanor Walker, she used those studies and applied them to the experience of people affected by domestic violence. She proved that many years or any long-term traumatic experience in domestic violence leads to learned helplessness, and that people affected by domestic violence very often have this syndrome. They don't seek aid. They just keep suffering. They accept that as their fate or their cross they need to bear. I have quite often heard this phrase about the cross, actually. Like, this is my cross, I will bear it. They consider this situation without exit. And when these researchers conducted these studies, they found out a solution. I will. So yeah, here on the slide there is more details about when specifically the helplessness starts. It occurs because of the lack of control, and that's the key point in this model, which we can further use in the communications with the survivor. Lack of control. Our task, our goal is to provide them with this feeling of control. The third webinar, I will be speaking about how we can help our survivors, but the key point here is to give the power back to them. They need to get in control of their own lives again. So such a survivor needs to start taking the control back. And here, it was said that the lack of control causes helplessness. How they found it out? In those very cages, they implemented special buttons when the dog could stop the electric shock. So to remove this electric current. And when the dog found this button and turned it off for some time, then they turned it on again, then the syndrome of learned helplessness never occurred because the dog was actually controlling this abuse. It was able to stop it, at least for some time. And this availability of control prevents learned helplessness. This is the feeling I can stop it, provided there is a way to control the traumatizing factor. If we don't have this control, then the learned helplessness syndrome is very likely to occur. And I've started saying about the fact that Seligman and Meyer found a solution. So what they did for that, they entered the cage, and what they did, that's a cruel way, of course, but they took the dog by its skin and simply dragged it out to the door, just forcing it to understand, forcing to get a physical experience of the fact that there is a place where it will not suffer, it will not be hurt. So they simply dragged the dog to the exit. They did it once, then put it back into the cage, electric shock again, then they took it out again until the dog at some point, at some repetitions, just stands up and starts walking to the exit. And then they said, yeah, that's what we call learned optimism. So they didn't just discover the learned helplessness syndrome, but they also discovered this experience of learned optimism. In the case of the dog, which just stood up and tried to quit the situation. Seligman now is a very well-known psychotherapist, one of the authors of positive psychotherapy, happiness therapy, so-called. After discovering that learned optimism, he started studying deeper phenomenon of happiness, and he's a very well-known theorist. And if you want to, you can find his books in the network and his speeches too, so you can learn more about that. But we are interested in the fact that this was how he and Meyer discovered this syndrome, and this syndrome is something we encounter very often in cases of domestic violence. And after them, there were other ways discovered to help the survivors with learned helplessness syndrome. And the first very important type of intervention in case you see this syndrome, because actually the person with a learned helplessness syndrome never seeks aid categorically, absolutely no way, because she decides that, yeah, well, that's the way it is, that's how it will work, because she has already tried fighting, running around the cage, and she understands that this exit is just illusion. She doesn't believe that the door is open. She tried fighting her way out, and she did not succeed. So she knows exactly there is no way out. And we can metaphorically sort of notice from the outside seeing what's happening with the one inside the cage. We are social workers, we are psychologists or neighbors or family, even relatives. Sometimes we see that this person suffers, the door is open, there is no wall, just stand up and go out. You just need to drag yourself to the exit. There are shelters, there are there is a family, there is your mother's house. You can go to your neighbors, to friends, to whatever. We from the outside, well, it seems to us that she is suffering and she likes it because she does nothing. She doesn't move. She just keeps suffering. And here we must say that she is not like totally inactive. She goes to her work, she talks to people, but her behavior remains within this situation of domestic violence. So from the outside, it looks to us that occasionally she gets well hurt very much, but she does nothing, so she sort of likes it. And quite often I hear it, especially from police officers or from various social workers who have already been burnt out, or other people providing support. The comments like, okay, we suggested her to go to a shelter, we suggested some help, we can get her a court order to get her protected, but she doesn't want that, so that means she likes it. Maybe she's into this thing, she likes suffering, and she doesn't go anywhere. So when you have this idea, just remember about that learned helplessness syndrome, because in her reality, her mental her mind is in this tunnel now where she's incapable of reaching the exit, of getting out. And here there is another way out in addition to this learned optimism, because that's also a very cruel solution. Then they were quite cruel with teaching those dogs this learned optimism. And quite often, this learned optimism, in my understanding, is this pathway used by our like responding services, state services, social services, yes, local authorities. We just take these sort of dogs and drag them through the traumatizing floor, telling, yeah, to get to the shelter, you need to go to the police. And without going to the police, you will not be able to access the shelter. That's traumatizing, because going to the police may lead to even bigger trauma, even more violence from her partner. So this learned optimism, well, of course, it does give you a result, but that's not a perfect way, not the best intervention. In the case of learned helplessness, the perfect intervention is crisis intervention. When we get inside the cage, we take this dog, well, metaphorically, a dog, take her on our hands and carry out to a safe place. Carry out to a place where she can get her basic needs met, to sleep without anxiety. Yes, the normal sleep restores. She starts understanding what's going on with her, and she restores her capacity to make decisions. She takes her agency back. So, in our world, that's the perfect intervention when, in this learned helplessness syndrome, the person gets an opportunity to go to a safe place with safe people. So in this crisis intervention, we focus on security. I will speak more about that on Friday, but the main idea is that in this learned helplessness syndrome, we move this person to a safer place. And the third option, and yes, that's well, we found this way with one of our partners. This way out when the person is not getting dragged to the exit, there is no learned optimism. When no one does a crisis intervention, but the person gets up and does something, that happens when this person faces a danger, a threat to her kid. And we saw quite a many cases of people looking for aid while being learned helpless when their kids were threatened.
So say, I've been suffering that for 20 or 30 years. So, okay, I would keep suffering. But my child told me, Mom, if you're doing nothing, I'm going to leave home. And most probably they will leave home. Then the mother gets afraid, or like, Mom, unless you start doing something, I will slaughter him at night. And then the mother can no longer sleep at night. She's concerned that the child would be in prison eventually, and then she comes for help. And there, it is very important how we develop our approach to assist this person, because these people have very little resources to keep investing efforts into resolving the situation of violence. With learned helplessness syndrome, people do not come for help directly. They do not directly help for situations of violence. It is quite possible that with these people with learned helplessness syndrome, when they contact the healthcare sector, I mean, very often these people have some somatic issues. They may have some other diseases. Quite often, this may be psychoneurological issues or digestion or heart-related issues, cardiovascular conditions, or gynecological issues. So quite often, if we work under this framework, if we counteract violence, we need to engage health professionals, doctors who can diagnose domestic violence and learned helplessness syndrome. And this is the entry point where these doctors start talking to the survivor, explaining that what's happening must not happen, that you have the right to live a safe life. This is violation of human rights, and that all over the world, governments, state, public systems are obliged to intervene and ensure your safety. If you have this healthcare colleagues, even individually, if it is not possible to organize that systemically, because if your country has ratified the Istanbul Convention, then there is the obligation for the state, for the government to implement measures to involve the healthcare system into the framework of counteracting and identifying GBV cases. But if it is not the case, at least individually, you can deal with those You can be in contact with those doctors who are aware of that survivors may come to you for help. And they may suggest a safe contact to the survivor. This is someone who can listen to you, who can help you, and maybe you will find a way out with him or her. So in this communication, so again, let me reiterate that this category of survivors usually do not come to NGOs or social services for help. They don't go to the police, of course. They may also be identified by education domain workers, like psychologists at school or the teachers of their children who may observe certain reactions to domestic violence, and they may also refer them if they have safe contact with that person, if the victim trusts that person, or those could be also people around, friends, neighbors, or some family members. People who are close to the survivor, they may observe this learned helplessness syndrome. They may see that the individual doesn't go anywhere with her problems. And this person may be the entry point to change the situation within this framework. And here, there is a very important marker. When I hear that they share a story with arrogance in a mocking way, where they say, well, she likes that because she doesn't go anywhere for many years. She has been suffering that, so maybe it is okay for her. Maybe there are some benefits for her, or that's an appropriate situation for her. When I hear that, I always start thinking about learned helplessness syndrome. I start talking to that person about what was explored or analyzed in 1964. Several more comments about the learned helplessness syndrome, that this is about the person being convinced that nobody is going to help me. Now I will never resolve this situation. This is really my permanent context now. And quite often the attempts to break free become less frequent, or people stop trying. They develop various depressive syndromes, and they decide that they cannot do without assistance. They cannot act. So if it is about the learned helplessness syndrome, people must get some support. Another model of the wheel of violence, this is the so-called Minnesota model. We also have it in different languages. Today, I'm not going to go into detail here. I will just say a couple of words about this model. So we will start with this model next time on Wednesday, because this model helps us understand the perpetrator's behavior. In the heart, in the core of this model, of the Minnesota model, which was invented by colleagues from Minnesota Center for Combating Domestic Violence, well, they said, forget about Walker's wheel. Here is the wheel. Use this one, this wheel. So let me just briefly explain the idea of this model, and the day after tomorrow, we will start speaking specifically about behavior of the perpetrator. So what's specific about the Minnesota model? According to it, the root, the core of any violence is a need for power and control. I want you to do what I tell you to do, what I say. This is my will, and you must do that. Power and control is about the need that, well, I am not going to explain why, I'm not going to negotiate, to collaborate. I just tell you to do something and you must do that. Minnesota model suggests this kind of sectors, and these are the strategies that the perpetrator uses, applies, in order that my wishes came true. And mostly these are strategies of psychological violence. And Minnesota model, you can see that in the outer circle, it says violence. And this is physical violence. So according to Minnesota model, while physical violence is working, meaning while psychological violence is sufficient, there is no need to use physical violence. If I can just bark on someone and everything happens as I wish, I don't need to attack. But if it doesn't work as I expect it to work, then I start using physical violence. Minnesota model states that every act of physical violence is preceded by a long period of psychological violence. Physical violence is usually applied when psychological violence does not work as efficiently enough for the perpetrator. And also, physical violence makes psychological violence effective, meaning if I humiliate someone or intimidate someone and it doesn't work properly as I expect, then I apply physical violence, and then next time my intimidation will work more efficiently because we already have this experience of physical violence. We already have this experience of my power and control, my dominance, my being higher in the hierarchy. That is why Minnesota model is very important. Why our colleagues from Minnesota say that we should forget about Walker's wheel. Think about that for a second, and then I will answer the question. Okay, so Walker's model, the wheel where we have these phases, Eleanor Walker's model is focused on behavior, feelings, and emotions of the survivor, of the victim, what she feels, what she thinks, if she comes for help or not, if she feels. While Minnesota model says that it is the perpetrator who is the focus in the core of violence, and we need to consider their strategies, how they force this power and control over the other. So here are the strategies that the perpetrator uses. So